right. Well, let's go ahead and get started here. Thank you all for joining us today. This is our 16th installment of our Roundtable series. We're lucky enough to speak with our colleagues in Alaska today. So I'll turn the table over to them here shortly. But before we get started, I want to introduce myself. I'm Ashley Millenbaugh, one of the coordinators here at the Public Health Center of Excellence on Dementia Caregiving, alongside my colleague, Elma Johnson, who you all probably recognize as a familiar face by now, along with the center itself. So excited to have you all here today. And before we get started, we'd like to just ground today's session in our land acknowledgement and just reminding us that the University of Minnesota Twin Cities is located on traditional, ancestral, and contemporary lands of Indigenous people. We acknowledge with gratitude the land itself and the people. We take to heart and commit through action to learn and honor the traditional Dakota values, courage, wisdom, respect, and generosity. And I'm hoping that you'll see those cultures and values through the work of our center today and always. Um, it's also important to think about how we can translate these words into action. And I'd like to point you all to the Minnesota Indian Women's Resource Center here on the screen. And invite you to learn a little bit more about it, but also invite you to think about your own community and maybe organizations that you might be able to approach and support in your area and locally as well. All right. So many of you are probably already familiar with our center, but for those of you who might be here for the first time or are new here, the Bold Public Health Center of Excellence is designed to support state, tribal, and local public health agencies nationwide in developing their dementia caregiving focused programming. And we do this through improving access to evidence-based programs and practices, facilitating connections and collaboration among public health agencies, and also many other service organizations. And we also provide technical assistance for identifying, selecting, and implementing effective public health interventions and strategies. So you can always connect with us. Our email will be shared at the end of today's session, but also through our TA or technical assistance request form. You can see that up on the screen here. It's a good way to submit any questions. And even if you don't have a question off the top of your mind, but you just want to connect, that's a good way to connect with us as well. It looks like my screen stopped sharing. Apologies. Or Elma, are you still seeing my screen?
Actually, I'm not, and I might have clicked something
Oh, no problem. Give me
on
one
my
second.
end. So please try to share again.
Okay, there we are. All right. So just a couple of reminders for today. This session is set up in a meeting format so that we can converse and learn from one another throughout the meeting today. But I do remind you to please mute yourself, turn the video on if you're comfortable doing so. It's always nice to see some faces that you're speaking to. And we also welcome you to change the name and include your organization in your Zoom title if you'd like. You can also put it in the chat. Please try to use the Q&A feature to submit any questions for our speaker. Sometimes the Q&A does get hidden in your toolbar. So if you see 3 dots on the side, it might be within there. You're also welcome at the end when we have our Q&A session to raise your hand and we can unmute you to ask your question as well. But throughout today's presentation, feel free to put any comments, resources, and links into the chat. Feel free to use those reaction buttons. Let our speakers know that you're there. And just a reminder that today's recording and slides will be shared within the following couple days here. So those will be available in your email, but also always available on our resource hub. And lastly, we will be sharing a survey with you following today's presentation. So this survey really does help us shape our future webinars, our future roundtables, and learn, what works well for you all. So here is, if you have time to jot this down, we'll put it in the chat, a link to that evaluation or survey. You can also scan the QR code, but we'll put that in the chat a couple more times. All right, so we do like to get an idea of who's joining us in our audience. So on the screen here in just a moment, you're going to see a poll. And if you could just go ahead and select how you're joining us today. And in just a moment, we'll share that on the screen here. So it looks like we got about 40% of our attendees joining us with bold public health agencies, another 20 to 25% from other public health agencies outside of those bold funded ones. A number of community organizations are joining us today as well. And, people living with dementia themselves, someone who may be a caregiver or just interested in learning about this area, and a care professional or other as well. So thank you all for joining us here today. All right, so let's turn it over to our speakers here today. We are excited to have Stephanie and Ricky here with us. We appreciate you taking the time to share, what makes Alaska unique, and, while you might look different than some of us here in the main land, some of this stuff could still be applicable to us, and excited to learn from you today. So. With that, I'll turn it over to you, Stephanie. I'm going to stop sharing and welcome you to share your screen as well.
Absolutely. Thank you. Ashley, we call you the lower 48.
Ah, okay.
Let's see. And let me go ahead. Did I give you the right one?
We are seeing like the presenter view, so we do see your notes in the next slide.
Okay. How about that?
Perfect.
All
Thank you.
right. All right. Well, thank you, Ashley and Alma, for the invitation. We find that people are often interested in how things are going in Alaska and what's going on up here. I live in Anchorage. That's the biggest city in Anchorage, or in Alaska, and this is on land of the Dena'ina people, Dena'ina Athabascan people. And I grew up about an hour away in Wasilla, which is also on Dena'ina land. I want to start out talking, this is just kind of an overview of what's happening in Alaska, or what's the situation. We like to show this map of Alaska just to help people understand the geography and the size. And so to the left is an accurate portrayal of the geography of Alaska, or the area of Alaska. And on the right, what that's showing is what's called a hub community, being Bethel, and then the surrounding small villages that are served by Bethel. This is called the Yukon-Kuskokwim Delta region. And some of you know the Mississippi Delta as being a pretty big delta. So this area, actually, the entire state of Louisiana would fit inside of this delta. So you have a size comparison there. Alaska has 229 federally recognized Alaska Native tribes. We have about 60,000 residents that don't have internet at all, and about 200,000 residents that only have low level broadband. So no streaming, no Zoom meetings, anything like that. Basic internet. So we were asked to talk about, how does caregiving work in Alaska? What are some of the things that may be unique or maybe the same with everybody else? One of the things we have some state-run facilities called Pioneer Homes, and there are 6 across the state, everywhere from room and board and some recreation. That would be a level 1 activities, all the way up to 100% 24-hour full care would be a level 5 community or level 5 facility. And that's limited to just a few beds in Anchorage only, and none of the other locations. So this is about 500 beds across the state for people who may be in need of it. Cost ranges from, for that level 1 facility, about $3,500 a month up to about $16,000 a month for those services. Oh, we're not advancing. There we go. One cool thing that we did actually before I joined is our dementia coalition, called the Alaska Dementia Action Collaborative, put together this caregiver resource guide, and it has local resources for Alaska, but also kind of a breakdown of what caregivers might expect, or learning what is the progression of dementia, all the way from just we're noticing some changes all the way through the progression of dementia. And if we can drop that into the chat, that link would be great if people want to check that out. We're working on it right now to, we're updating our online version with some accessibility things, and then also next year we'll be working on a full update. It's been a few years since this has come out, but still super popular. It's our most popular thing that we hand out when we're tabling or at events. So it's still asked for really frequently. Something that we started a couple of years ago is going into our larger communities, but looking at opportunities to meet with unpaid or family caregivers and offering them the support. We know that professional care partners get that training and get that opportunity to work with their colleagues and to learn and to stay up to date with best practices on caregiving, but our family care or caregivers don't always have those opportunities. So we've started doing these summits where we invite family or the unpaid or informal caregivers to come together and have those same opportunities. So we have presentations and some practices in actual caregiving techniques, and then also resources. One thing that's super cool that I just love is we also have respite available. So our caregivers can bring their people, and so we don't have that barrier of needing to find someone to care for an individual so that the caregiver can attend. Go ahead and bring everybody, and being able to provide respite there on site. Another activity that I'm looking forward to hearing some feedback from you all about is this year we did a guardian survey. We reached out to, we have about 1,500 guardians statewide for adults who are in need of that legal decision maker. And if we estimate about a third of those are for individuals who have dementia, we can estimate about 500 guardians potentially in Alaska for people who have dementia or related needs. And so we talked about everything from, how do you get your caregiving? How do you pay for it? What about housing? What about other activities? And how do you get from here to there? How do you get your groceries and that kind of thing? And so I have just one data slide for us, some of the results that came from that survey, and I would like to stop talking now and actually ask if anybody else has done anything like this, a guardian type survey. We would like to repeat this, ideally, Anjali, annually. We'll see how it goes. But just wondering if anybody else has had any similar surveys, and if you um, would be willing to share how that went, or any really valuable questions that you learned from.
And we welcome you to raise your hand or put a response in the chat, please. Elma, thank you for putting the question in the chat too.
And Stephanie, this could be questions just from a general caregiver survey, right?
Absolutely, absolutely.
Not necessarily only guardians as defined, maybe as a
Correct.
legally defined role. Okay. So it
Yeah.
could be also questions, anything related to dementia caregiving that might have been used at your agency, or you've seen your state use, or your local health department, um, in an effort to understand the needs of caregivers.
Yeah, and that's why we did this survey, is we didn't find a lot of this. We didn't find examples really of other people who were doing this, and we felt like this was some really valuable information for us, especially for advocacy and for some of our partners that work more in the legislative realm, and having some solid data to support our asks, or to support what we're working on, we felt was really valuable. If you do have ideas, or if this is something that you've done or have seen in the past, I'd love to connect afterwards.
And I see that Miss Jessica Player just put in the chat that in South Carolina, the Department of Aging did their caregiver needs assessment, but this hasn't been updated since 2000. But it sounds like there will be new results coming out later this year.
Great. Awesome. Thank you. Okay. And then next, this is a new project that we've just started this year. We're at the very beginning. This is a nationwide organization called Village to Village. And how it works, it's basically a membership. So you join with I don't know if it's an annual or a monthly membership, and it's run by volunteers or maybe some paid staff. And the idea is to help people to stay home. It provides vetted um, professionals who can come to the house and help out, do things at home, just by paying that membership fee, or the subscription, and then you can be a part of this, and you can call, and it's everything from needing a ride to a doctor's appointment, to needing someone to come and shovel your driveway. Um, Anything like that that you can think of that's relevant in your community can be added into this. And so this is another one. Because this is brand new to us and we're actually not up and running yet, I would love to hear if anyone has participated in Village to Village or something similar, if you know of other similar programs. Okay. Well, again, if something comes up, or if you have heard of things, I would love to connect with you after. Um, okay, thank you. And I'm going to turn it over to Ricky, and Ricky will share some exciting things that she's working on as well. So thank you. We'll have time at the end for some questions.
Set my slideshow up here. Oh, and I don't want that there. Hold on. Moving things around. Good morning. My name is Ricky Chapman. And I'm going to introduce a little bit more about myself here in just a second. Um, so I'm going to talk about the Alaska Statewide Care Training Project that I have been working on this whole year. It's been an incredible adventure, and I'm really enjoying what we're working on. This is a partnership. So I am with the Alaska Training Cooperative. This is a longtime standing agency that has provided low cost to free professional development and continuing education for Alaska's behavioral health and direct service workforce. We are a part of the Center for Human Development under the University of Alaska, and the College of Health is where we're tucked away and located. We do not provide academic focus at all. We are mostly for workforce, so that's where we're at. And we are part of the USEDS. So we partnered up. We were provided a grant in last year, and we partnered up with Alzheimer's Resource of Alaska. We are also a part of the Alaska Dementia Action Collaborative. And we started on this project. So the state of Alaska, SDS, came to us and provided us with some money. This was inspired by the call for action that you saw there, the 10-year map to address Alzheimer's disease. We're looking at this goal number 2 is to establish dementia capable workforce ready to meet all of Alaskans with ADRD. Let's see here. We created a training project mind map to look at what we have in our state that worked for us, and the people that we needed to reach out to, the professionals that we were looking at. Like I said, we do not, my particular agency, we focus mostly on workforce. So we were looking at the workforce that needed and then the training that is needed out there. So our phase 1, we came up with a couple of deliverables. We have more than this, but these are our primary ones, was to develop a dementia care training core competencies for professional care partners. We used known materials from other agencies through like National Institute of Health. The Illinois Department of Health also has a really good core competencies set up, and so we reviewed those and some other things that we have within our state that focus on that as well. And then drafted, created, and it was vetted by the Dementia Action Collaborative in July. We were asked to increase our mental health first aid for older adults instructors. Mental health first aid, I'll go over that in another slide. So we went from 1 at a, so we have 2 with Alaska Training Cooperative. We increased it to 1, and then we added 4 with Alzheimer's Resource. So Alzheimer's Resource has 4 trainers for mental health first aid for older adults. Alzheimer's Resource is also working to develop a clearinghouse website, which will be a one-stop shop. So the caregiver guide to resources, this would be something similar where professionals can come and look for training and other resources within the state. So phase 2 came about, and we had created the core competencies, and now we are developing, I have developed the content for the dementia care core competencies. Oops, I'm sorry. I did not mean to move that. There we go. So down here, that won't let me highlight. Keep clicking on the wrong screen. Sorry about that. So you see down the page, we have the dementia care core competencies for professional care partners. That's one of our biggest focuses this year, was to build the content for that, build it on an LMS so that it is available all the time for people. Because as you see, our state is incredibly huge, and we cannot always bring people into training and bring them to us. We go to them, and we bring training to them as whichever way that we can. Sometimes internet, sometimes we just go out there, right? So we also created a dementia training needs assessment. Stephanie just asked about surveys. So this is our latest survey that we had as well, parallel with her survey. And this was for professional care or professional providers. We just got the results back from that, and I'll touch on that in another slide. We were asked to deliver 10 free mental health first aid trainings to rural communities. So, and then of course Anchorage as well. So we were able to deliver in Anchorage, Mat-Su. We have, we're scheduled to go out to Valdez next week. We've been to Kenai, Fairbanks, Ketchikan, and Juneau, and we had somebody from Sitka come and visit us in Juneau. it's a little bit of a hop over, not too much of a travel. And then the same thing with the positive approach to care training. This is I've created a workshop for our assisted living homes here in the state that I use to deliver the positive approach to care training for our rural communities. We also created a 6-session echo, which just completed 2 days ago. And for FY26, and this echo focused on dementia, and then we're working on our 12-hour dementia training package and then finishing up that clearinghouse. So going forward, we have, let me just move forward. Okay. So those of you who do not know what the positive approach to care is, come talk to me. I am so happy to share about positive approach to care. I'm so happy to tell people about this. I tease about it. I was like, I have drank the Kool-Aid. I am a convert. I am absolutely sold on this. It is a method created by a woman named Tipa Snow. She's out of North Carolina. She has been doing this a very long time, working with elders, working with people who are experiencing dementia. And she developed an incredible method that works pretty immediately. I've had folks call me back the next day and be like, "Oh, I used the positive approach to care after training yesterday at the store and it worked." And they're just excited. We have mental health first aid for older adults. This is another proprietary training, and this is an 8-hour training that equips caregivers to be able to recognize developing mental health issues, potential crisis, distinguishing them from, typical aging, and then giving them the option to build up confidence to respond in a way that is compassionate and appropriate. Our echo here. So we had our 6 sessions. We had about an average attendance of 200. It was very well attended, very well received. The feedback has been glowing. I'm really excited for these folks, and it has, opened up a lot of things for people across the state. They know about more resources. They know more about more issues. They have more knowledge on what dementia is. And how it works in our communities as well. So my showcase here is the Dementia Care Competencies for Professional Care Partners. This is an e-learning module. The idea is, looking at, and I've been training workforce here, or caregiving workforce, for the last 5 years. And what I have noticed is we are incredibly low staffed. We're very, are minimally staffed. We have a lot of distance. We have people living in places where getting to training is very difficult. So my idea, like I said, is to bring training to them. The e-learning modules are set up so that they go through one module, and it has a knowledge check every few sections so that the person has permission to, oh, okay, I can stop, go back to work, and then come back to this later. It's set up to be as accommodating to the learner as possible. We have links to Tipa Snow videos. We have licensed videos from the PAC team. So we have those available to folks. Then we have resources that they can use and job aids that they can take with them from the module and use for themselves in their assisted living homes immediately. We're currently in the pilot stage, and then we will be launching it, going live soon. Our professional training needs survey. We had about 88 respondents. Sometimes it's really hard to get people to respond to surveys. But overall, we were looking at folks seeking behavioral management, dementia-related distress, kind of trainings focused on that, community challenges, and working with families and caregivers. Another note, and these were just the top 3. Another note, the coming up real close, number 4 in the ranking of what people are looking for, was culturally significant trainings. And so for that, the way that we're responding to that is the PAC trainings that we are working with. We've spoken with PAC and their representatives, and they are very, very supportive and in alignment with adapting PAC to cultural competencies. And so that's something that we're looking forward to in the future. I do want to just note here, because we are such a rural-based state, one of our big focuses is aging in place. The challenge is aging in place when you live in a rural space, right? Or you've homesteaded your own home and you live on 100 acres out in the middle of the woods. How are we going to, support you, right? So we've got some big challenges in our state. But we meet them very well. We've got some great funding. We have great collaboration with partnerships with Stephanie, with Pioneer Homes, with Alzheimer's Resource. We're reaching out to community or collaborations across the state because the idea is to make sure that the entire state is included in on this. In May, we are holding a positive approach to care event to train educators in this method. We have selected providers from across 10 Alaskan communities, including Galena, which is interior, outside of Fairbanks, really outside of Fairbanks when you think about it. It's a lot more space than it looks. Kilowog and the Aleutian Pribilof Islands as well. And so the Aleutians are the ones that came off that big long chain of islands that went out to the left. And we are going to bring them in to Anchorage and train them up in positive approach to care, and then create a network of these trainers across our state to help support them in providing this as we go forward into the future. This little glimpse into our next endeavors that we're looking at is trying to do this again in the fall as well to get even more. And the goal being that we have PAC trainers within every region of Alaska. We have 8 regions. And that we are able to support them in training folks in this method so that we have boots on the ground no matter what, because I can't fly everywhere. I try, but I can't. There we go. Thank you very much. There's lots of questions. Oops, I gotta stop sharing. Oh, this QR code will take you to the training calendar for our training, and we have a lot more than just dementia training. So I'm gonna stop my share. There we go. Oh my gosh, so many. Yay, Tipa fans.
Great. Thank you, Ricky and Stephanie, for your insight and time. Lots of interesting programs and ways to stay connected in such a expansive state, right? Please, anyone, feel free to add some of your questions into the Q&A, and I've been checking the chat as well.
I see Michael has his hand raised.
Oh, go ahead, Michael. Let's unmute you here.
Thank you so much for this. I think I read somewhere that you have both the Eden alternative and you're also using positive approach. Are they at the same facilities or are they at different facilities? And if they are at different facilities, I'm just wondering which one are you finding better?
Primarily the Pioneer Homes, Michael, use both Eden and Positive Approach to Care and use them pretty collaboratively. They're really set on continuing with both. They have similar plans for outcomes, but how they go about it is very different, with Eden really focusing more on competency of the provider, and so that the providers stick around and are well trained and feel competent in the work they're doing, whereas PAC focuses more on the work that the caregivers are giving. So I know Pioneer Homes has been very happy with both of them and plans to continue with both.
But I believe PAC has been used in the state since I want to say 2017. Yeah.
Mhm.
Thank you, Michael.
And then Kathy has a question of how do we go about recruiting for the Dementia Echo? We have connections. We just mostly reached out. So the one thing about Alaska that I stress because I do a lot of foundational training for direct caregivers, and I tell them all the time and providers, you have to be networked in this state to get anything done. You have to know people. You got to make friends. You got to reach out and talk to folks and go to events and introduce yourself because then you learn and you meet folks, you meet me, and then I can connect you to, hey, I'm connected to the University of Alaska. We have Dr. Brittany Howell, who is focused on rural dementia needs and has a rural dementia focus, as well as Dr. Steffi Kim, who also is doing dementia focus on rural health here in Alaska. Then we've got a couple of our echo folks who have connections out to their within their world. Alzheimer's Resource had a few connections as well. So just working together is one of our biggest ways to succeed in the state. We have a big state, but a fairly smaller population. Super diverse, very, very diverse population. So that's another challenge, but it's a fun challenge. So, yeah.
Related to that comment, Ricky, I know you had mentioned that you're in contact with oh gosh, the Teepa Snow team related to the
Yeah.
cultural relevance. How do you tie that into, some of the trainings that you're doing now outside of that?
So we do I when I treat or sorry, when I work on my trainings outside of the dementia, like outside of dementia training or yeah. I have folks that I can talk to like, hey, does this make sense? Does this meet cultural significance or does this is this offensive? But it really is one of the things too. And I just touch on that we have like so Anchorage alone is more culturally diverse than Miami, LA, New York. Like we are really culturally diverse. And so with that, knowing that, I just tell folks, you have to be open, you have to be flexible, you have to be willing to, try things that kind of weird you out and you're not sure about it. You'll learn, you might like it in the end. It might be strange, it's different, but it's a part of the job because we're working with people and we have to meet them where they're at and work with them in their way. I can put myself aside. I go to work with my person, and then I can come home and it doesn't, yeah. Sorry, I didn't expect that question. But yeah, so we work pretty hard. We do, we have our land acknowledgments, but we have a lot of folks we have or had cultural teams in the university that we could go to talk to about this to make sure things are in alignment. Um, yeah, there's just a lot here. It's pretty supportive when you start thinking about it.
Yeah, and Jeff, I'll get to you in just a second, but I see Susan Beth posed a question in the chat, kind of, piggybacking off of the one that I just asked. But do you tie in, reaching out to the community members and like asking them for their feedback on the content as well?
Yes, so Alzheimer's Resource in particular has two Native Alaskan folks on their team who are that's their part of their job is to be cultural what's the term like bridges to try to make sure that everything's set up correctly or that they're reaching out to communities. One of the things within Alaska is if you're not necessarily a part of that Native community, you may not have a way into that community. And face-to-face interactions are really important. Knowing your connections to each other are pretty important. So having someone on the team who can help make those connections as well and open those doors is a way that people have been successful, and Alzheimer's Resource has been doing that. Um, PAC itself, and so the dementia education itself is fairly in alignment from what I'm interpreting with a lot of Alaska Native cultures there. The one of the big things is Tiba says slow down. And that's the Alaska Native cultures tend to be their tempo is a little more steady and slower than my born and raised San Diegan, quick, fast, city tempo. And so Tipa's, her big thing is slow down, take your time, honor that person's, experience, and be with them in that moment. And so I think that that aligns fairly well with what we're doing.
And I'll jump on that one as well, Ricky. Susan Beth, a couple of things that when I'm talking about cognitive decline and dementia, I like to be sure to acknowledge that in many cultures in Alaska and elsewhere, um, dementia isn't a bad thing.
Mhm.
It's a part of the journey. It's not abnormal or wrong or anything else. It's a part of the journey. And so being sure to recognize and honor that, um, honoring different perspectives that ADRD isn't a bad thing. It's just something that we can talk about and part of the progression of a person's path. We also, one other partner we have is with the Lucian Pribilof Island Association. They have an elder program that works pretty closely with us as far as the education piece and like elder groups and potlatches and that sort of thing. And it's been very beneficial for me having that support and having a trusted messenger that I can go to when I recognize that I'm not the person that needs to be delivering these messages, right? And being able to have those partners that we can work with so closely and trust each other that can get those messages out.
Thank you. Jeff, I see you've had your hand raised for a minute here. Go ahead.
Yeah, that's fine. I'm Jeff Zoll. I'm calling in from Oregon, and I have a couple of questions. One is, and Oregon is pretty rural. I mean, it's interesting to see the geographic comparison with Alaska. It really sort of it's stimulating my imagination. And so one of the questions is when you mentioned that there are limitations on internet access, is that something that you feel like you can work on? Like I haven't really heard that being an issue in Oregon. At least, I'm in public health. I'm going to tell you this very quickly. I've been working in public health cancer for the over 20 years. And years ago, I was pulled into not aging services, but like um, long-term care. And I just wasn't able to sustain the career. So I moved over into public health. But I'm getting pulled back. You guys are pulling me back. I was in a conference yesterday, and it's just like it's popping. And so I really appreciate your comments because there's a way that we identify with this calling. And I really appreciate your messaging. And Ricky, it's like, I'll be straight with you. I'm getting a little bit of the fire hose of experience from you. But at the same time, if this call is being recorded, it's like, okay, I want to go back and watch the recording because it's wonderful that you have so much information to share. But, I'm one of those folks that I was identifying with that I need a little time to take it in. But I am in that experience of being called to this work. So that was one of the questions as far as what can we do to address the need for internet connection? Because in our time currently, there is so much valuable, helpful information that's being communicated through internet channels. And I'm ready to participate in that. I'm a little shy, but here I am working with it because I think this is really like a key to how we're going to make a positive difference. Um, there was that, and the other question again, because I'm so new, so thank you for having me. But, I hear in passing, in terms of medical science, that there seems to be some hope for new drugs and to address Alzheimer's medically. Are you part of tracking those developments?
I am not.
No,
Yeah, and
we're
go ahead.
not in that realm at all as far as the research and development of those. No.
Yeah, that question is coming from personal experience. We lost a family member. My girlfriend's mom had early onset dementia and ended up dying from the disease. And my sister also had early dementia and died from situational related death. And so I'm very close to the experience. And so it's like, okay, with the time that I have left in my working life, I think this is really where I want to be. So thank you. Thank you.
Yeah, thank you, Jeff.
If we have a moment, I'll touch on the medication aspect, because it's interesting to me. So
I was going to touch real quick on the internet.
Okay, yeah, do that first,
let me
Vicki.
explain. This is going to explain to you why internet is difficult in Alaska. This is an internet GCI tower in probably, I think, January. Do you see? That's all iced up tower right there. That's why internet is very difficult in our state. So we have, I mean, like we have towers and we have GCI runs pretty strong here. They're an Alaskan company. But that's one of our biggest challenges is in the summertime, everybody's gone doing their summer stuff. And a lot of folks here, majority of the folks here, are subsistence. So they're fishing, they're, out doing their things. And so training during the summer does not happen for us. We train August to June. And between the tourist season too, because we're also a huge tourist community. So I cannot get out to like right now, getting to Valdez from Anchorage, which is like maybe an hour and a half, 2 hour flight. Within a week, the prices of that stuff has nearly doubled, like flights and hotel and everything, because tourist season started a week ago. And then in the wintertime, our weather is so extreme, especially on the YK Delta and other interior areas, that the snow's over. You can only get in and out through plane or snow machine, maybe in between villages. But yeah, it's a pretty interesting whole other world that we deal with here. A lot of folks do use Starlink. And so that it's a personal thing. So some people will have personal connections to Starlink. And I've known folks out in the YK Delta who've used it, but for the most part, it's also exorbitantly expensive. And it's very hard. The villages that we have, our rural villages, are not financially robust. And so they do struggle with being able to afford things like internet, and it's a luxury and it's not something. Food's more, and heating fuel is more important. So yeah, that's our internet.
Yeah, a lot of the communities will have a hub, like a community center or something like that. And culturally, that's very important and revered space. And a lot of times that will be the location that has internet. And so it will also be a meeting place where people can go and access the internet there when it's accessible. And schools, yes, yes. I wanted to touch on also the thing about the meds that kind of ties in with what Ricky was talking about. One thing that's really exciting is as new meds are developing, meds that are more stable and that don't require going to an infusion clinic or don't require refrigeration, or are able, if something, it's okay if it gets frozen or if it's okay if it sits out for a bit. There are a lot of, as Ricky implied, there are a lot of barriers also with getting meds to people in rural and remote communities. We have partners working on developing cold resistant drones that can deliver those when a flight couldn't make it because of weather. that maybe we can still get some drones out there with some needed supplies. So that's currently in development. We're really excited about that project. That's going to open up a lot of opportunities for people in the more rural and remote areas.
Very cool. Thank you. Thank you for your questions, Jeff. Continue to go ahead and throw some of your questions in the Q&A and chat. I do have, let's see, a question. I'm going back to the village to village idea. I think the concept of that is really interesting. And you had mentioned that it is a paid membership. And Ricky, you put a comment in the chat just saying that there may be, and I just want to make sure I'm understanding it right, a volunteer component. It sounds like, are you saying people can volunteer to be one of those people, providing?
Yeah. From what I understand is, like the services, right? I need a ride. I need somebody to come shovel. I can say, oh, I can come shovel. Thanks. Like they put out the call, and if I'm on there as a volunteer, they would reach out to me and say, hey, do you have time to go shovel Mrs. Jones's driveway? And yeah, sure. And then from what I feel like I got from the presentation, and Stephanie, you can correct me if I'm wrong, is that then I bank that time for the future as well. So maybe I'm a retiree and I've got, time on my hand, I can do volunteer work, I can give people rides, and then I bank that up. So then when I'm in a place where I can't drive anymore, I'm like, hey, I've got some time banked in and I can use that. So that's what I was understanding from it.
Yeah, that was my understanding as well. And like I said, it's still new to us. And so the minutia we're not familiar with it yet, or we don't have experience with it yet. But yeah, it's really open to that give and take relationship. So, but yeah, it is, you get vetted to be in this network of volunteers. And then when you're in that, then you can, like Ricky said, the call is put out and go from there.
Mm-hmm. What a cool way to build community and support and keep it hopefully going that way. In the same topic of that village to village program, and again, I know that it's a newer thing, but thinking about building dementia capacity, are there ways that they're trying to incorporate dementia care specialists or someone that's trained in dementia care specifically to also be one of those volunteers? Or
I think ideally that would be the case. One of the things we're doing is developing statewide our community health worker program. And so we're not quite there yet as far as having specific dementia specialists within the CHWs, but that's a goal of mine. And I think most of us in this work that that is a future project. We're not there yet, but we would like to see it go that direction.
I think we're definitely laying the foundation for that, Stephanie.
Yeah, absolutely. Absolutely.
okay. Well, we have about 5 minutes left yet if anybody does have any remaining questions. If not, we can wrap a little bit early. Thank you, Stephanie and Ricky, again for taking the time to chat with us today. We will be recording and sharing this so you can come back to it, like you said, Jeff. But again, thank you all. This is, how we learn from one another. And we look forward to continuing our roundtable sessions here with you all.
Thank you so much, Ashley.
All right. Thanks, everybody. Take care.
Thanks, everyone. Have a good rest of the day.